Hi, everybody. My name is Carolyn Dubé. I'm the Executive Director at Fertility Matters Canada. We apologize we're a few minutes late there. We had a technical issue, but I'm thrilled to be here with you this afternoon or this morning, depending on what part of Canada you're in, with Dr. Premal Patel. He is a urologist with the University of Manitoba and also one of our brand new board members at Fertility Matters Canada. We're thrilled to have him working with us, and I'm really thrilled for him to be here with you today talking all about male reproductive health. Premal, I'm going to take a step back. I'm going to let you, I know you've got some slides to share, and I'll pop back in and manage and moderate questions. So if you're here live in Zoom or on Facebook, please feel free to ask questions, and we'll have Dr. Patel answer those throughout our session this afternoon.
Great. Thanks, Carolyn. Appreciate the opportunity to talk to all of you today. So today I'll talk a little bit about male reproductive health. I'm going to focus more about male fertility and lifestyle, nutritional factors, diet, exercise, and how they kind of all play in part. So just kind of going through it. So as some of you may know, infertility is quite common. So 8 to 15% of couples are unable to conceive after 1 year of regularly unprotected intercourse. And so when we look at how much of a component can male factor be, well, the male factor can actually contribute to about 50% in male infertility overall. And the cause of male infertility can be multifactorial, with up to 35% of cases of male infertility idiopathic in nature. So what that means is that about a third of cases of male factor infertility, we don't really know what's going on. And that's where we want to discuss some of these other potentially lifestyle interventions that could be contributing. And so when we talk about causes, so what can cause male infertility? So when we go through some of the more common causes, so varicoceles, which are dilated veins within the testicle. And as you can potentially imagine, so arteries take blood to an organ and veins take them away. And so when you have these dilated veins that are not taking the blood back to the heart in the normal fashion, the blood pools, causes excess heat to the testicle, and it can damage the sperm. So it can impair the sperm concentration, the movement of the sperm, the shape of the sperm, and even the DNA of the sperm. So varicoceles are one of the most common causes for male factor infertility. Other causes of male factor infertility could be low testosterone, sexual factors, systemic disease. So people may potentially have diabetes, high blood pressure, a number of comorbid medical conditions, if they've had previous sexually transmitted infections, and sometimes children who have been born with undescended testicles, so testicles that are not within the scrotum at birth, they may have problems with fertility later on in life. But as I kind of alluded to before, a large proportion of male infertility is actually unexplained, and that's where we start discussing other potential causes likely related to lifestyle. And so when we talk about oxidative stress, so a lot of this is newer stuff that we're learning, especially about the sperm and kind of how important it is to ensure that sperm quality is as optimal. But up to 80% of infertile males were found to have increased seminal vesicle levels, so seminal levels of these reactive oxygen species. And these reactive oxygen species can damage the sperm. So what they can do is cause problems with protein damage, the fat portion of the sperm, the biomembranes, and even the DNA damage. And all these together can contribute to sperm damage and overall lead to infertility. And so when we talk about antioxidant supplementation, so that has been a growing industry with male factor infertility. The biggest issue is that the data that a lot of the medications use is actually quite poor. So we don't really know exactly how beneficial taking a lot of these antioxidants can do. The other question is also, is there any harm in taking too many antioxidants? And so when we talk about what are commonly used antioxidants, so even when you look at most sperm supplements, if you go on Amazon and you look sperm supplements, you're going to find a whole list of different supplements, but the majority of them are going to include most of the same ingredients, and that could be vitamin C, vitamin E, B9, selenium, zinc, CoQ10, carnitine. So a lot of these different ingredients have been shown to improve sperm motility, morphology, and concentration. So it's not surprising that a lot of these different supplements that you see end up including most of the same active ingredients, but then are differentiated by a few other ingredients that may not actually have that much benefit to them. And so when we look at some of these studies in male factor infertility, so participants were treated with the antioxidant So this FH Pro for men, this included 119 men with idiopathic male infertility. The other group consisted of about 30 men. And so when they took these supplements for 3 months, and we typically use 3 months as a surrogate for how long it takes for sperm to regenerate, it did find some improvements in conventional sperm parameters and sperm function. The important thing to note is that a lot of these studies did not look at birth and especially pregnancy. So we don't really know, does it actually change anything with respect to fertility outcomes? This is just, again, demonstrating kind of the difference that we saw before and after. So before, we're seeing further improvement in some of those parameters. And so more recently, though, 2 large studies were just published. So this one, this MOXIE study, which was published this year, looked at vitamin C, vitamin E, selenium, carnitine, zinc, folic acid. So again, a number of these ingredients that have been found to be improvement in sperm motility or sperm concentrations, and they had individuals with male infertility take them for 3 to 6 months. However, at the end of the study period, they did not find any improvement in sperm parameters or DNA integrity. Furthermore, there was no improvement in pregnancy or even live birth. So this study actually went against a lot of the prior studies in demonstrating improvement in sperm quality with supplements, but this study was one of the largest ones ever published. And again, these are just some sort of the results. Again, you can kind of see that there was no significant improvement in any of those parameters pre and post therapy. So just another study that actually came out this year as well in the Journal of the American Medical Association. So another large study of over 1,000 men. These were randomized to either take folic acid and zinc. And again, same results as the previous MOXIE study. So use of folic acid and zinc supplementation by male partners compared to placebo, so not taking any active ingredients, did not improve live birth rates or sperm quality after 6 months. So again, these studies do demonstrate that we still need to be a little bit cautious as to what supplements we're kind of recommending, and especially who we should be recommending those, because overall, we're not finding a significant improvement by taking a lot of these supplements. So are supplements effective and safe? So a lot of this stuff is from the US, but with respect to supplements, so the FDA does not maintain the same level of regulation for dietary supplements as for conventional food and drug products. And so the biggest thing, the ability to actually evaluate these supplements, is extremely lacking. So these supplements, to be sold, they don't require high quality data to start selling them. They can just start selling them regardless, as they don't fall under that criteria for the Food and Drug Administration. And so one study that we did that was just published this year, we looked at the top 17 supplements that were found on Google, Amazon, and a lot of these wholesale websites, and we looked at the ingredients. So what were the ingredients in a lot of these supplements? And again, so 22% of ingredients used were found to have published evidence of randomized control trials. So 78% of the ingredients had no evidence for them whatsoever. And so we don't really know whether they're causing any harm, but that would be the differentiating thing, is that most of these supplements tend to have those similar ingredients that were thought to improve sperm quality and concentration, but overall, they're really only differentiating themselves by a number of ingredients that we don't really know what they do and whether they're harmful at all. And so switching from that supplements to diet, we do know from a number of pretty good studies that unhealthy eating is associated with worse semen quality and less favorable testicular function. And when we talk about testicular function, we mean testosterone levels. And so specific diets actually have a unique implications. And so when we talk about the different diets, when we look at the Western pattern, the prudent diet, the open sandwich pattern, and the vegetarian, like you can see here, just even based on this graph, is that there's a huge disparity between the different diets. And then when you look at the Western pattern, we're actually seeing lower sperm concentration, sperm count, the motility of the sperm, as well as the motile sperm count. So again, diets higher in meats and saturated fats tend to actually overall lead to poorer sperm outcomes than those more focused on, such as the prudent pattern. So diet is important. And I think that kind of goes to what I was saying before about the supplements. In a majority of men, supplements probably do not cause any improvement in the sperm count as long as you're eating a well-balanced lifestyle. Most of the nutritional supplements that are required to maintain sperm and to have good sperm counts, if you're able to get it in your diet, you don't need to top it up with additional supplements, because it's unlikely to cause any improvement in your sperm count, and it potentially may cause some downside effects, as too much antioxidants may actually have the opposite effect. And so same sort of thing when we're seeing the diet. Poor diet does affect fertility, and a lot of this good quality data is coming out of just how important these lifestyle factors can play. So, when patients come to me and ask me, well, what supplements should I be taking? I always say, well, let's talk about your diet first. Let's focus on the diet. If you find that, potentially you're too busy at work, or you're not able to maintain a good, healthy diet, then maybe supplements may be right for you. But I think it's always important to not just give supplements as a carte blanche to everyone with infertility. So just switching now into some of the other lifestyles. So when we talk about exercise, weight management, and alcohol and smoking. So one of the biggest studies that was done previously was these population-based studies. So these longitudinal investigation of fertility. So these life studies. And basically they had 501 couples attempting to conceive in 2 geographic regions in the US, in Texas and Michigan. And they were recruited from 2005 to 2019. And so they want to look at a range of environmental exposures and lifestyle characteristics. So follow them over time and see if there's anything that's potentially contributing to infertility. And so when we look at physical activity as a whole, so actually lower levels of physical activity and increased body fat were associated with the reduced sperm counts. And so when we looked at 79 fertile and 72 fertile men at 4 fertility centers, same sort of thing. So again, we found that individuals who had higher body fat were found to have lower sperm count than their cohort that was found to have lower body fat. And the same was seen when we talk about exercise levels and physical activity. And again, sorry, this is just kind of stressing some of those factors. So again, the body fat, the numbers greater than 1, this doesn't cross over 1. So essentially what this tells me is that there's essentially a significant association with body fat. So lower body fat and higher levels of physical activity. So this was greater than 150 minutes per week were associated with improved sperm counts. And so when we talk about what kind of activities, so some of the studies have looked at what kind of activities. So outdoor activities, weightlifting, biking. And so specifically for this one, individuals who did more outdoor activities, weightlifting, actually had improvements in sperm parameters. So could there be anything that potentially could be detrimental? And let me go to the next slide. So one thing that was actually found to have a little bit of a detriment to sperm, some of the sperm parameters, was actually cycling. And so a lot of this theory just has to do with the fact that you're sitting on the bike, it's causing excess heat or pressure on the testicles, and that can actually contribute to lower sperm counts. So overall, physical activity is important. And the other thing is also trying to make sure that whatever physical activity you do is trying to change it up, whether that's going to be biking here and there, running, weightlifting, using a different combination of activities. Biking itself may cause some detriment, just like as I kind of alluded to, just from that pressure, especially near the testicles. But overall, physical activity is definitely important, especially for those couples that are having issues with fertility.
Dr. Patel, I have a question. That's really interesting, because I've heard this, you hear this cycling, tight pants, having a laptop, and you're probably going to touch on this a little bit later, but I was curious to know if someone was experiencing lower sperm quality or numbers, and they were an avid cyclist, if they stop cycling, is there an opportunity for their sperm count or the sperm parameters to get better?
Oh, sorry, Carolyn, you cut off there for a minute.
Oh, sorry. Can you hear me now?
I can hear you now. Sorry, I heard the beginning part.
That's okay.
If someone was an avid cycler.
Yeah, if someone's an avid cycler with lower sperm quality or low sperm count, if they stop cycling, is there an opportunity for these parameters to get better?
Yeah, it's a great point. I mean, that would probably be the first thing that I would ask someone to do. So say if I was seeing somebody who came into my clinic who is an avid cycler and they may be cycling a few hours every day, so something that's, that they're really into, what I would do is try to cut that back, maybe switch to another activity for the time being, running or elliptical or weightlifting, and then let's recheck the sperm count in 3 months. It's really hard to say, especially if there's potentially something underlying that's causing that's unrelated to the biking. But it's a good point. That's usually what I do. So if somebody it's almost equivalent to someone who comes in with a poor sperm count that may be sick at that time. So if they have a cough or flu or something, you just say, well, let's just recheck it again in 3 months and see what happens then. And in most situations,
3 months a specific time period?
Yeah, so 3 months, we typically use that as kind of like a carte blanche just because it takes about 74 days to sperm to turn over. So usually 3 months is kind of enough time.
Awesome. Thank you for that.
No problem. So again, some of these additional studies is a little bit of a confusing table, but basically the thing to take away from this is, again, waist circumference. So individuals with higher waist circumference also had higher, worse sperm counts. And again, increasing waist circumference and elevated body mass index were associated with worse sperm count, concentration, motility. And then when we move on to other lifestyle factors, so thinking about alcohol intake. And so these were two relatively large studies. One was more of a North American population. The other one was more European. But as you can see here, so basically in one of the groups, as alcohol intake increased, the number of standard servings per week increased, there was the decline in the fertility. So they found a drop in the number of the sperm concentration. However, this wasn't seen in the other cohort. And then when you take it as a whole, it wasn't really associated with that. But again, we don't really know exactly what's going on. We do know that alcohol in itself can cause an impact, especially with the sperm quality. So I tend to, whenever I see my patients in clinic, I always tend to try to keep everything to a minimum, especially when we can see here is that maintaining just mild levels of alcohol intake doesn't necessarily have that drastic of an impact, but when you start consuming more alcohol during the week, it definitely can contribute to some problems with the sperm quality. And then, so how about smoking? And so we do know that smoking can cause significant impacts with the female fertility, but it can also cause problems with male fertility as well. So smoking has been found to impair sperm parameters, impair the DNA of the sperm, so the quality of the sperm, and even male smoking can actually impair ART outcomes. So people who undergo intrauterine insemination, so in vitro fertilization, and actually abnormal sperm parameters in male with in utero cigarette smoking exposure. So it not only impairs your own sperm parameters, but it can also impair the developing uterus, the child as well, if it ends up being a boy, and potentially also can cause issues as well for females as well. So it is important to take these things into consideration. A lot of times we think, oh, well, I may not be necessarily affected by this, but it definitely needs to be taken as a whole. And so just finally, so oxidative stress is an important factor in male infertility. I think this is an important topic. We're learning more about it. I think it's always important to have a discussion about fertility supplements before just taking them and seeing if they are right for you. Because the biggest thing is that evidence behind supplements is currently lacking. Antioxidant supplements are a developing treatment option, although they do have inconsistent evidence. But things that we do know is that diet has a strong impact on fertility parameters. So it's always important to try to optimize diet, exercise, weight loss. And just as we discussed, so lifestyle factors contribute to male infertility. Moderate physical activity is very important. Try to reduce alcohol consumption, and smoking cessation is definitely paramount. We know it can impact your sperm concentration, but can also impact the unborn child as well. So.
Wow, that's really interesting.
Perfect. Thank you so much.
Thank you for that. So I do have a question. This isn't one that's been submitted, but it came up as you were speaking about the smoking. I'd love to know, we've legalized marijuana in Canada, and I'm curious to know, is there an impact on marijuana, smoking marijuana, on sperm quality?
Yeah, it's a great question. Because legalization of marijuana in Canada, and then when I was down in the US, there was a bit of a lead time for I believe a couple years. And so there was a lot of studies that have looked at this. Some studies have saying that state that potentially there's impaired sperm motility, so the actual movement of the sperm. Others have been inconsistent. I don't think we have that high quality data to say whether it does or it doesn't. I think just like everything else, it has to be in moderation. I can't say for certain whether it's going to cause any problems to the embryo, to the child. So we don't know. But I mean, ultimately, when I see patients in my clinic, I try to get them to stop. And if they're unable to, if it's for medical reasons, I just try to cut it back as much as you possibly think you can, because we don't really know what it does.
Awesome. Thank you for that. We do see that sometimes in some of our support groups online. Typically females asking for advice about their male partner who may smoke marijuana, and they had heard, it can impact. So thank you for addressing that. I guess like anything else, if you're preparing to have a baby, you try to make your body, both partners' bodies, as healthy as possible in preparation for a potential child.
Yeah, and so it's always difficult, especially with marijuana, because it does have a lot of medical. I mean, there's a lot of medical indications for it. Some people take it for chronic pain, and they may not necessarily be able to come off of it. So I think it kind of goes in both ways. One, it's good that we all the studies that have been done have been inconsistent. So it's not that they've been shown that it can cause problems, but we don't know. So I mean, I think the important part is that if you can cut back, try to, because we don't know if it does. If it causes problems, if you're unable to, then at least nothing has been shown that it causes problems. Okay.
I'd love to kind of go back. So if there's a male or a couple who thinks they may have an issue, how, number one, what would be sort of the thing to say, maybe it's you, or maybe we have an issue here? And number two, how do you investigate if there is an issue?
Sounds good.
What are some things that men could expect to be asked to do?
Yeah, that's a great question. So anytime a couple, so just as I was kind of saying before, so 1 year is usually our kind of landmark as we define as infertility. And so if a couple have been trying for 1 year and there's been no pregnancy whatsoever, they should both get evaluated. If the female partner is older, so she's 35 and older, they should consider getting investigated sooner. So we usually say about 6 months. And the reason for that is because as women get older, reproductive potential goes down. You want to find out if there's an issue going on in both couples. And so what can the male expect? So, I think it's always been a little bit of not a tricky discussion, but I think it's always been something not as discussed because, women tend to get more involved in the healthcare system a little bit earlier with pap tests. And so they get involved with their doctor a little bit earlier. Men don't often require early physical examinations and tests. So they don't often see their doctor until they're later on in life. So they often don't know who to turn to. So I think the most important part is go to the family doctor, and then they may run some preliminary tests. So what you can expect is some blood tests. And so what they do is look at some of those hormones, so testosterone levels and some of these pituitary hormones, which help produce sperm. Other tests that are going to be required is semen studies. So typically we do 2 of these. They can be done 1 or 2 weeks apart. And essentially you can do it at your own, the safety of your own home, and then provide the specimen to the lab, usually within an hour. And then once we do those semen studies, the blood work, then we do a physical examination. So again, that's going to look for the secondary sexual characteristics. It's going to look at the mostly focused on the scrotum and the external genitalia, see how big the testicles are, see if that vas, so that tube that delivers sperm, is it there? As some men don't have vas to begin with, and some men may just have 1 vas. So there's a few different things that are involved. But the physical examination doesn't tend to take very long. The thought of it is a little bit uncomfortable, but it tends to be pretty quick. But that would be the general workup for male factor infertility.
Great. And then if there is an issue. So say, what are some of the issues, I guess, that that could be discovered, I suppose, would be the question. So if someone was found to have no sperm in their sample, would there be additional testing? I've heard, we can get, you can extract sperm specifically straight from the testes. Is that something that's an option for people?
Yeah.
I'd love to know a little bit about that stuff.
Yeah, it's a great question. So, the semen study really drives the further investigations. And just as you kind of talked about, right? So for the biggest thing, when I look at a semen study, I look to see is there no sperm? Is it poor sperm quality, or is it normal, right? And so let's touch on that no sperm. So if there's no sperm, does that mean that you don't make sperm, that you make no sperm? That's not true, right? So it takes 1 to 2 million sperm just to make one sperm in the ejaculate. So you could actually be making sperm in the testicle that is not coming out. And that's where we may consider doing sperm extraction. Just you're talking about, sometimes you can use a needle, you use freezing medication, where we can take out sperm, and couples can do IVF, and they can have a biological child. Other situation is where men make sperm, but there could be a blockage, okay? So what can happen is that the sperm is being produced in normal amounts, but it's just not getting out. And in those situations, what I tend to do is a biopsy. I do a biopsy. If the biopsy shows that the man is still making good levels of sperm, we can actually do a reconstructive procedure where we can actually get sperm back in the ejaculate, and they can conceive naturally. Okay, so that's also an option. So when a man is not producing sperm, I usually think of one or the other. Is it a blockage problem, or is it a production problem? And that's where the biopsy, along with some of the hormone levels, come into play. And that, most urologists are able to do biopsies and can kind of differentiate between those things. When men do not make sperm, there are some genetic tests that we tend to evaluate we tend to order as well, so that we can find a cause for it. But only in 15% of men who do not make sperm on that semen study do we actually know what the diagnosis is. And the other don't know what's going on. But that does not mean that they do not make sperm in the testicle. That just may require a sperm retrieval and doing something like IVF.
Okay, wow, thank you. There's quite a few options here. It's really interesting because I think that a lot of times, not only for patients, but for the general population, we would assume that the majority of times, infertility is a female issue. It's her problem, it's our problem. But in fact, male infertility or issues with male reproductive health are quite common, and I'm really glad we're having this conversation. And now listening to you, I'm thinking, wow, there are so many things that that can be wrong. And you would never know necessarily until you were tested.
And I think that's the biggest point, even in men who have normal sperm parameters. So if you do a semen study and you're like, oh, my numbers are great, that does not mean you're fertile, right? So if a couple is having problems with fertility, the male should be evaluated, ideally by a male reproductive urologist, someone with subspecialty training in male infertility, because even if you have normal numbers, you may have varicoceles, which are those dilated veins that could be causing DNA damage to the sperm. And that's not picked up on a regular semen study. That actually needs an additional test. So, and we're learning a lot more about how important sperm quality is. It just doesn't matter that there's a lot of sperm there. We also need to take into consideration what the quality of the sperm is like.
Absolutely. Now, do genetics play a factor? Or can
Yeah, absolutely. Yeah, 100%. So, one of the most common causes for one of the most common genetic causes for male factor infertility is something called Klinefelter's. And so Klinefelter's is where someone would have an XXY, so an additional X chromosome. And so, most often than not, that's often not picked up until the time that they're trying to conceive. And, the male gets evaluated, he doesn't make sperm, he sees a male reproductive urologist or a urologist, and then they do the investigations, and then they find out he has Klinefelter's. So it's often not picked up early on, but that's a very one of the most common genetic causes for male infertility. Another common cause is so a male has an X and Y chromosome, And on that Y chromosome, there's an area that's specific for sperm, for making sperm. And so you can have deletions in those areas that can cause male infertility. And so those can actually be passed on from father and son. Sometimes they are just random genetic mutations, but that can cause male infertility. Individuals with cystic fibrosis, so those who have cystic fibrosis, so lung disease, a lot of times they actually don't have VAS, so that tube that delivers the sperm from the testicle out, they don't make any sperm whatsoever. They don't make any sperm in the ejaculate. They make sperm in the testicle, it just doesn't come out. So there are a lot of genetic causes for male infertility. And again, we're learning more and more about these, and I think as time goes on, we'll be able to identify what exactly, hopefully identify more causes of it.
Yeah, wow, that's really interesting. Thank you for that. So if you're out there and you're watching this and you know that you've been diagnosed with one of these conditions, or you have some questions, it's really important to get in touch with your family physician. And would you then suggest to get referred to a urologist, a male reproductive specialist?
Yeah, absolutely. I think it's important to see somebody, even it doesn't need to be a male reproductive urologist, even a urologist, because all urologists are in Canada. We're all trained to deal with male factor infertility, and then if it requires any other, some of these reconstructive procedures, then they would refer to someone like myself who would do these sort of procedures. But I think it's just important to, the more things you know, the more knowledgeable you are, the more empowered you are, and just like fertility. Oftentimes couples have been trying for 2, 3, 4 years until they see me, and then time goes on. And so you don't want to delay the process further. You want to kind of get onto it as soon as possible.
Absolutely. We do have a question that's come in. Does taking testosterone increase my sperm count?
Yeah, it's a great question. I'll tell a little bit of a story. There was a study back several years ago which asked this sort of question to a lot of urologists. And it actually, unfortunately, but a large proportion actually thought testosterone increased sperm numbers. But it's actually the opposite. So when you take testosterone, your body tells itself, the body's going to say itself, well, I already have enough testosterone. I don't need any more. So it actually shuts off your testosterone, your internal testosterone production. And actually, at about 3 to 6 months, your sperm count can sometimes go to 0.
Wow.
So it can completely shut off your sperm count to either low levels or nothing at all. And sometimes it can take a few months for it to come back as well. So the longer duration that you're on testosterone, the longer it can take for the sperm to come back. And sometimes it doesn't come back if you've been on testosterone for years and years. So it is important to really be cautious of testosterone. And just as I was talking about supplements, there's all these testosterone boosters and this and that, and it's hard to say what actually is in these ingredients. We don't even know. There could be testosterone in themselves that could impair your sperm. So I think it's important to be very cautious with testosterone, especially when you're trying to conceive.
Wow, yeah, that's really important. Another question that we've got: as a woman gets older, her fertility decreases, but it's not the same for a man. Is that right?
Great question again. And so as we're learning, even just recently, this past 1.5 years, we're actually learning that sperm quality in men decreases over time as well. And so, fertility is definitely not just a female issue. This is definitely a male issue whatsoever, as well. And the quality of the sperm can actually decrease over time. And so instead of having the DNA of the sperm, instead of having normal genetics, when we look at the genetics in older men trying to conceive, the actual quality actually decreases as well. So it is important to understand that men are not in the all clear.
And so I know that, we talk about the female reproductive health declining sort of after age 35. We really are looking at a more significant decrease there. Are men and women on the same timeline there?
It may be a little bit older. It's hard to really gauge that. It's definitely hard to answer that because we don't know. I think because as you mentioned before, it's always been held that fertility is more of a female issue, so we know so much more about it. But the male factor, we're still learning more about it. I'd probably say as men get older than 40, 45 is where we're starting to see some decline in the quality of the sperm. But it's, yeah, we definitely don't have fixed cutoffs.
Okay, that's interesting. Because you sometimes hear in the news or you see older men who seem to be having babies. And by older, I mean, sometimes in their 60s, celebrities in their 60s and 70s, having children. And typically you don't see that with the female. So that was a really good question, because I think that helps with the myth that male fertility never does decline. So they don't really think about it that way.
Yeah, absolutely. It definitely doesn't have as much of well, it's even hard to say because we don't know, but I mean, it definitely doesn't have that big of as much of an impact as female aging does, but it definitely contributes.
Okay, it's good to know. It's really good to know. So one last question that's come in. My sperm count is normal. Does that mean I'm fertile, or could I be infertile?
Yeah. So again, really good question. When we look at these sperm tests, all they really tell you when you look under the sperm sample under the microscope, it's going to tell you, how many sperm are there, how many are moving, what direction are they moving in, what do they look like. They don't really give you the fertility potential. We can assume, and we probably, we have some good data that says the more sperm you have, the more likely you are to be fertile. But that being said, men with normal sperm parameters, so normal levels, could have problems with fertility. And that falls under that whole umbrella of what is the actual quality of the sperm like, the DNA of the sperm. And these semen studies, although they're great tests, they don't tell you what the quality of the sperm is like. They just tell you what the sperm looks like. And so you actually could be infertile and have normal sperm concentration, movement, motility, all those factors. So that's why it's very important to get evaluated by a urologist, and ideally a urologist with subspecialty training in male infertility.
Awesome. Hey, thank you. So that's all the questions that have come in. Premal, do you have anything else that you'd like to add before we tie things up today?
No, thank you for thanks for the opportunity. If anybody has any questions, my contact information is on the website. I'm more than happy to answer any questions whatsoever. But thank you for the opportunity.
Yeah, thank you so much. It's really important that we continue the conversation about male reproductive health, because so often we do, not just our organization, but you hear in research, or maybe not, well, even research, I suppose, but online, most people talk about the female. And so as an organization, we're really committed to bringing more information about male factor infertility and male reproductive health to our viewers, which is why we're thrilled that Dr. Patel has joined our board of directors, because this is his area of expertise and his passion. And we've got some more things in the works. We've got some more information, some really interesting stuff that Dr. Patel is involved in, and we're going to be bringing that to you over the coming weeks and months. So Dr. Patel, thank you so much for your time today. We really appreciate it. And for everybody who joined us live, or if you're joining us on the recording, thank you so much. Please reach out to Fertility Matters Canada for all of the information you need to help you on your fertility journey. Thank you.
Thank you so much.